Welcome to a PsychoDelicious conversation on mental health issues and trends from two local mental health professionals in the greater Lansing area. I'm Michael Stratton, LMSW.
And I'm Morgan Bowen, DNP, PMHNP, and we're here to provide you with a deep dive into the human experience of consciousness and beyond. Our aim is to be educational and entertaining, so just kick back and open your ears and your minds.
Hey, I'm Mike Stratton.
And I'm Morgan Bowen.
And this is a PsychoDelicious conversation, and we're going to talk about all kinds of stuff today. It's a very deep conversation that we're having. Morgan got a hold of me earlier in the week and suggested that we talk about healthcare and how it's going with hearings with RFK and the vaccines and all that kind of stuff. And I suggested, well, let's make it a little broader and make it
more broad than that.
more broad than that, and talk about how just the whole politics of today, the whole zeitgeist of fear, the atmosphere that's in the air, the fear and rage, how that's impacting our clients, how we're dealing with it, and all of that kind of stuff. I threw it back to Morgan. Morgan came up with a very complete outline, very interesting, that we'll be checking in on. And I'll let you take it away, Morgan. And
well, I wanted to come up with some structure, for the conversation, because this is, it's a large topic. It's, so we run the danger of going off into many different directions, which is nice. I enjoy doing that, but we, have a limited amount of time to talk about things. So yeah, this week there was the Senate discussion. I don't know that they were hearings, but discussion with RFK Jr., who's the Department of Health and Human Services, the secretary. And he had, it wasn't him, but the head of the CDC left, and there were some questions about what happened there, as well as some concerns about changes that were made to the vaccine schedule. So I watched it, and it's striking. I mean, it's very striking. As a healthcare clinician, it's just very striking what is happening. So
and not just that, but in the last few days, I mean, one thing that heated up was the whole Epstein file thing. The book, was the birthday book to Epstein, came out, and the letter that allegedly Trump wrote is in it. And then just within the last 48 hours, Charlie Kirk is assassinated. Mm-hmm. And the killer has just been caught. I believe that happened this morning. So this puts a pin in time of where we are. Mm-hmm. And how dire the news has been and how fast it's coming at us. Mm-hmm. And I do have clients who talk about just being overwhelmed by
it's huge with my client base.
Yeah.
And I can't imagine, I think it's huge with everybody.
Including us.
Yeah, including us as
individuals. Though it doesn't affect us.
Oh, you guys did a whole episode on
we
that.
Did.
Yeah.
We did. It's been in my mind quite a bit. So, I tell my clients there's so much to pay attention to. So if you can, pick one or two things to really pay attention to. So for me, and use that as a guide to regulate your interests, your thinking about all the things that are happening socially. So for me, one is health. Is healthcare. That's a huge part of my profession. It's important to me, just public health, and that can mean a lot of different things. But generally, the health of our country, the health of our society, the health of the people in my community and my family, my own health. So, the Department of Health and Human Services is sort of the top dog when it comes to that. So, mm-hmm. So I do pay attention to what's happening there, and that's where the strikingness came from for me, and so that's what kind of got my brain a whirling.
You broke this down into the micro level, the meso level.
Yeah. So the people, if my background is very academic. Well, I'm a clinician. I see patients. I work directly with people, day to day. But I have quite a wide academic background. I was woke before it was cool, and then not cool. So, and not ashamed in any way of that. And I use, my learning, and this is theory, this is, lots of years put in reading and studying and being a scholar. So the micro, and I am being kind of, I don't know what the word is, flagrant about that. I think that's come into question as being, of value to society, and I insist that it is. And so you may hear a little tension in my voice over that, but maybe that's part of what has triggered me this week. So, and part of mental health is being honest with where you're at, So that's a piece of this for me. So, we look at things in on many levels when it comes to like larger system-based health. So micro things are, the day-to-day of myself, the people in my family, what's happening in my micro system. And then the meso system is kind of more on the community level. What are things going on, with organizations in my community, clinics, this is healthcare-based lens. And then macro is socially, large, whole country, the World Health Organization. So it can be a helpful way to like think about, what we're talking about, which is how the larger structures in our life and in our society affect health, and in particular mental health.
It's one thing I think that's at stake right now, as far as the macro level goes. I feel like it's like a question of what's real and what's not real. And that goes down to, what we see on our phones, whether it's a Facebook feed or Twitter or TikTok or any number of things, and can things are AI generated in a big attempt to kind of influence us one way or the other. Who's going to dictate the narrative of what is true, what is real? And we've got a president right now who for years has been saying that is the fake news. The thing that we used to rely on, like, oh, well, it said on the news that this is what it was. We read it in the New York Times. We read it in the Washington Post. He's saying, no, that's the fake news. Don't listen to that. Listen to me. I'm the only one you should listen to. And it's been interesting with the Charlie Kirk thing of how much he's grabbed the headlines for this. He was the one who came out and announced that he had died. He was the one who announced we've caught the killer. He's done this, on television, precluding other news organizations or the way that would typically be done. He's really making a grab to kind of frame, this is what's happening, this is what it's about. So at a macro level, I think that who owns the narrative and who's going to dictate what is real, what is not real, I think a lot of people are on shaky ground of like, what do I believe? And this video that I saw, is that true, or is that something that's been made up or that's put on, or is it like a Russian bot that's trying to influence the next election in one way or the other? So.
Well, I think that, regardless of any one particular event, because there's so many events. I mean, Charlie Kirk's death is terrible. It's awful. It's political violence. There's many things about it. But there's, it's one in a series of, events, both politically directed violence as well as, larger social upheaval, change, tension that has just pervaded the color, the tenor, the experience of, I think, all of us. I think all of us.
Yeah.
And that kind of touches on the idea of what people talk about when they talk about zeitgeist, which is kind of a fancy, very academic word. But it is used, by, probably academic people. But
it's German, isn't it?
It is, and it comes. I at some point knew but it speaks to the spirit of the times. Like, what is the the general, feeling that's out there. You can't
the mood, the atmosphere.
You can't really put your finger on it. It's very difficult to hone down. It's very difficult to nail down.
German meaning spirit of the age.
There you go.
Of the age.
That, by the way, that voice is the voice of our producer.
Oh, hi.
The Delian. Hi. Hey.
I came out of the gate running.
I'm a middle child, so I'm used to being ignored.
You're literally middle here. Yes.
So I've heard the term, like listening to, different people talking about things being used pretty, regularly these days. And I used to hear it when I was in school and studying and things. But it's so appropriate for the usage now, because I think everybody feels, in talking with people, my clients, my family, my friends, there's definitely a feeling that is out there, and it's not I would say it's not a good one.
No, I think people experience being overwhelmed and being flooded, and I think that's intentional. I think when someone this is going to make me sound like I'm anti-Trump, but when he comes out and does all these executive orders right off the bat, the day he's elected, he issues 150 executive orders or whatever, somewhere in that neighborhood, and you can pick. You said kind of isolate what you want to pay attention to, because
the echo chamber we talked about.
You break down these different populations. So if you're Hispanic, if you're a woman, if you're gay, if you're anti-gun violence, which like who's pro-gun violence? Well, there are people who are pro-gun violence. All of these different populations get triggered, so to speak, in one way or the other, and it boosts their anxiety and can push them into either a kind of a helpless, hopeless kind of stance, or into a stance of just rage, but not knowing what to do about it.
And that's, I think,
mental health.
And I think that's the important connection between the macro, the things that are happening on a larger scale, and how it filters into the micro. These things impact individual people, communities, which is meso, but and have a real effect on people, both positive and negative. There's it can lead communities. In past, like adversity or difficulty can bring people together. It can sharpen or it can hone relationships that are supportive, and people seek out, things that are not only comforting, but also help them to make sense of what's going on in a way that is meaningful to them. But then it can also be so negative. It can be scary, terrifying, marginalizing, and this is how it can influence people's experience. But then, the macro stuff that's also really important is, policy, policy changes. This is what with RFK and the hearings are, that the changes that are being made on that level they filter down the downstream effects, which is a term you'll hear a lot, meaning the changes that are made in the here and now will then impact huge amounts of programming. Medicaid, Medicare, access to vaccines is a huge topic of conversation. And these real
consequences.
These things have enormous impacts on people, and you'll hear the stories.
Measles.
I can't. Well, and I went to my. This week I went to. I went to the pharmacy. I've heard folks in Texas going to pharmacy and they can't get the COVID vaccine. They want the COVID vaccine. And the pharmacist won't give it to them because they don't have, documentation from their healthcare provider. They don't have a qualifying health condition. There's a lot of confusion about what that is, what the policy is, how that impacts federal U.S. policy versus state policy. These are very important things that provide people the framework to be able to access and to interact with healthcare. And when you have a leader, the top leader, who is making changes, which changes are changes, but chaotic, not understood, not reasoned, not transparent, that leads
and
to
not,
real
not,
effects.
not based on science, not based on
Well,
science.
I didn't want to necessarily go there, but there is that. It's the chaos that is.
Yeah.
If you have a point of view, and that was some of the things that came out in the hearing. If you're making these decisions based on evidence, based on data, then please present that information. And it's coming, and we're doing that.
It's interesting because it hasn't necessarily filtered down to mental health yet, but I think it will. I anticipate that it will at some point. And I will tell this story. I'm in therapy, and my therapist a few months ago said, "Hey, do you mind? I use AI for my sessions now. Would you mind if I use AI to record our session and I use it to write my notes?" And I said, "Well, right off the bat, I have two problems with that. And one is, one thing we do know, research-wise, that anything that's observed changes the thing itself. So our interaction is going to change in some way. The second thing that I'm concerned about is it's one more step towards insurance, going on a case-by-case, session-by-session basis to say, we'll pay for this session because it was fruitful. We're not going to pay for this session because we don't think you're working on the goals that are stated in your previous treatment plan or something like that."
Well, this is not new. I mean,
think
this sort of thing has happened
Yeah.
many times with insurance companies. And insurance companies have a huge piece in this.
Yeah. Well, insurance companies, big pharma, a lot of the larger corporations, which the current administration seems to service the corporations more so than the individuals in the population, although they do a great job, again, controlling the narrative that we're about you. These other people are the bad people. These are the people we need to get rid of.
I would say they embrace the wellness industry, and the wellness industry, I think they would say, no, we don't do anything with big pharma. We don't want big pharma. What we want is, and what has been historically, RFK, as well as a lot of his supporters, there is a wellness product involved.
So
So that it's
can you define that? Because I don't understand.
Supplements.
Okay.
This product is it's natural. It's not pharmaceutically created.
Okay, it is what I thought. I just wanted clarification.
Yeah. So and the kind of the blanket term is the wellness industry, which is a huge, ginormous industry. Huge.
Yeah.
So the meso or the miso, sometimes you pronounce it miso.
Well, I don't. Miso is like the soup. Like miso soup. So I'm like, it's MESO. So
I would call it meso. But
do I need to look this one up?
But this, so community-based kind of stuff, or what's it look like in your neighborhood on a day-by-day basis?
Right.
As you notice poverty increase, do you notice more people standing on the corners?
Absolutely. And what are community organizations that are involved in, mental health treatment? So CMH would be a huge one, like Community Mental Health in the Clinton, Eaton, Ingham. One thing I've also been thinking a lot of is the Medicaid changes that are part of the one big, beautiful bill. And those are, some changes will be happening, but the major changes are going to happen after the midterms in I guess that'll be 2026, right? So, not sure that was coincidental.
It's pronounced meh. Meso. Okay, we're both
like
wrong,
mezzo
right?
soprano, or there. I think the estimate is 750,000 people will lose Medicaid in Michigan.
Man, oh man.
So that's 750,000 people who will not have insurance that did have insurance.
Yeah.
And
that'll have a big impact on the neighborhood for sure.
And particularly mental health. So a lot of people access mental health through Medicaid services.
Yeah. And
the idea is that mental health issues come with poverty. This is not general, but there is an association with what we call social determinants of health with poor health outcomes. So housing issues, being unhoused, homeless, housing unstable. This leads to stress. This leads to lots of problems.
At least they can still get guns.
Well, and this influences mental health.
I'm sorry. I'm sorry.
Since it's been season 2, Mike has just been punchy.
He's unhinged.
He's like,
I'm the.
You ain't stopping me.
No, there's no stopping me.
Poverty, food access. There's more healthcare access, transportation, utilities, all of these things that influence the quality of somebody's life.
Right.
Yeah.
And having poor access to them is going to negatively impact. So community organizations that fill the gaps in for that, homeless shelters and churches. Support groups or community centers. There's lots and lots of
NAMI,
things.
the National Association for Mental Illness.
Yeah, so these are the
families.
community-based things that step up in times of crisis, and there's always a presence.
The suicide hotline.
Yes,
is it 811? Is that
988?
988. Okay,
yes.
let's look that up again.
I'll take care of that. You guys keep going.
Warming shelters, cooling shelters. During times of issues.
988.
There's all these places in the community that can positively impact. And then, of course, there's, Moms for Liberty comes to mind. These more controversial. And there's also, certainly liberal groups that are more extreme, that may be more, problematic or
there's a new rescue mission being built on Walnut and Kalamazoo, I believe. It's going to house or care for twice as many people as what they've had.
So I think this is the mission. It's the new iteration of the mission, which is on Michigan and has been for many years.
Right.
So the access to those, the funding of those, because another thing that happens when, policy changes, people don't have access to health care, people don't have access to food benefits like SNAP, the community takes a hit. The community is on the hook for helping those who need help because they're not getting it from the federal or the state level.
And I don't know to what extent, this is kind of a big left turn, but it's another thing that's very pressing in other cities, but I don't know to what extent we've seen ICE in this community, people that are rounding up supposedly violent gang members, but what we've seen is they've wound up rounding up all kinds of different people who are brown, basically. Sometimes they're students in colleges who've written papers that are against the administration. That was a kind of a famous case that occurred a number of months ago. And I don't know that that's happened so much in Lansing, but the idea they've put on this huge push to give this incredible budget to ICE. That's going to be larger than the entire federal prison system currently has, and giving them $50,000 signing bonuses for people to sign up to be ICE agents. So basically, here's a year's salary up front if you can come and do this. So they're really trying to create a kind of an atmosphere that could potentially target homeless people at some point, that because that's going to be it's criminalizing homelessness as well.
So this was another thing that I've been thinking about, because with the National Guard presence in Washington D.C., which started in Washington D.C. but now has spread to Chicago, and LA I guess was the first one, and then I think I read Memphis is the projected next one. But so I was hearing a lot of people on social media, and honestly, I don't spend a lot of time on social media because it rots your brain. That might be controversial, but it rots my brain.
That's one thing I can agree with you on for sure. I'm down. Yeah,
it rotted my brain. So, but people would say, there's no homeless people left in Washington D.C. They've just, the problem has been solved overnight.
They're in Guatemala now.
Where are these homeless people? If this is actually true, that problem was not solved overnight. That problem was moved. That problem was transcendentalized into something else. But, that isn't magic. That does, So what is happening? What is Alligator Alcatraz? What are these things that are happening? And of course, I've been thinking about this, but for some reason, that the comments of like, oh, there's just no more homeless people. Whether or not that actually is even true, I was just like, that is not true.
Yeah.
It's just not true. So, we have to. I find it imperative with my background, my training, my education, to utilize my brain to help for myself to understand. I mean, for myself really to understand, because I am perturbed, I am upset, I am triggered, if that is the language that somebody wants to use. But I seek understanding of WTF is going on.
A PsychoDelicious conversation is meant for educational and entertainment purposes only. It is no substitute for therapy and should not be treated as such. If you feel a need for real therapy, you should consult your local provider, Google therapy or therapists in your area, check with community mental health, or a suicide hotline if you are feeling suicidal.
Mike and Morgan welcome your questions, feedback, or dilemmas. Feel free to send us an email at a psychodeliciousconversation@gmail.com. That is a PsychoDelicious, PsychoDelicious conversation@gmail.com.
The views expressed on this podcast are solely the opinions of Mike Stratton and Morgan Bowen, and do not reflect the views or opinions of any site broadcasting this podcast. Replication of this podcast without written permission is strictly prohibited.